As a UC San Diego Health employee, our patients and visitors depend on us to know what to do in the event of a fire emergency. You must know exactly what steps to take and follow the proper policies and procedures. Knowing and following them will help ensure the safety of our patients, staff, and visitors. We use RACE as an acronym to remember these steps. R is for rescue, A is for alarm, C is for confine, E is for extinguish, evacuate. Imagine it's a normal workday on your unit. You are walking by a patient's room and you notice an electrical outlet malfunction that has caused a fire in a nearby trash can. Rescue anyone in the immediate point of danger. Alarm. There are 3 steps to alarm during a code red. Verbally announce there is a code red to other staff members. Activate the nearest fire alarm pull station. Call the appropriate number, 6111 or 911. Give a good description of where the fire is. Tell the operator your name, unit, department, building name, address, floor, room number, what's on fire, and a callback number. Depending on your work location, some off-site clinics or business offices may not be equipped with fire alarm pull stations. The phones may also not have the capability to dial telecom at extension 6111. Become familiar with your area. Find out if you have fire alarm pull stations and what number you should call in the event of a fire. Make sure you know if you can dial extension 6111 or you have to dial 911 in a fire emergency. Confine. Confine the fire to one location. Automatic doors tied to the fire alarm system will close when the fire alarm is activated. These doors will create smoke compartments within the hospital. Staff must help by closing patient room doors. This will help limit the spread of heat and smoke to other locations. Extinguish. Try and extinguish the fire if it is safe to do so. We use PASS as an acronym to help remember the steps to use a fire extinguisher. Pull the pin, breaking the plastic seal used to hold it in place. Make sure you pull the pin completely out. If not, the extinguisher will not discharge. Aim the nozzle at the base of the fire. Squeeze the handle. Sweep side to side. Try to stand about 6 to 10 feet away from the fire. Always have an exit to your back. Remember that there is a fire extinguisher at least 75 feet of travel from any point in the building. Grab as many as possible just in case one extinguisher isn't enough. Evacuation. In the event the fire gets out of control, an immediate evacuation from your area is necessary. Follow these evacuation procedures. The first level of evacuation is horizontal evacuation. Relocate patients, staff, and visitors to an adjacent smoke compartment by crossing through smoke compartment barrier doors. This evacuation can be initiated by any nurse involved in the fire incident. The second level of evacuation is vertical evacuation. This evacuation involves relocating an entire floor to a different part of the building, usually 1 or 2 floors down. If a fire or smoke hazard is so extensive that horizontal evacuation was not sufficient, the UC San Diego Health Incident Commander, in conjunction with the fire department, will initiate a vertical evacuation. Verbal instructions will be given over the public address system. You can use striker chairs and med sleds located throughout the facilities to assist. The third level of evacuation is building evacuation. When vertical evacuation isn't sufficient, a building evacuation is required. This involves moving everyone outside of the building. Verbal instructions will be announced over the public address system. Like a vertical evacuation, this can only be initiated by the UC San Diego Health Incident Commander in conjunction with the fire department. If you're located outside one of the UC San Diego Health Medical Centers, like an off-site clinic or business office, your first step to evacuate would be an external evacuation. More detailed information on UC San Diego Health's fire response and evacuation procedures can be found in Medical Center Policies 802.3 Fire Response Plan and 801.2 Evacuation Plan. Familiarize yourself with your work area and plan in advance. Knowing what to do ahead of time will help ensure the safety of everyone.